Hi, this is my final project, and I focused my capstone project on communication in the workplace to build teamwork. My practicum took place on a medical surgical unit at Norton Women and Children's Hospital that had 31 beds. There was typically a 5-to-1 nurse to patient ratio with approximately 4 nurse aides on the unit to split the patients. The patients on this unit could range anywhere from a typical medical patient with pneumonia or the flu to patients having elective surgeries such as gastric sleeves. Most patients that are assigned to the unit have some sort of gastrointestinal issue. During my time here, I shadowed an assistant nurse manager. This allowed me to study the behaviors of the staff from a management point of view. My learning goal for this unit was for there to be an increased communication among the unit as a whole. This included better communication with the patients and between the staff members to improve overall patient satisfaction. I chose to form a form of communication that any employee could use for positive feedback. The shout out board was implemented to allow the staff to have a way to recognize each other for their work. This could be something small that an aide helped another aide with, or it could be some type of nice comment a nurse wanted to leave for an aide to read. I had three main learning objectives for this clinical site. The first one, the staff will have a quicker call-out response time, which will be demonstrated by higher patient satisfaction rates. In order to achieve this, I placed a roster of the patient assignments next to the call light in every computer at the nurse's station. This allowed the staff to have a faster response time to notify the patient's nurse or aide when requested. I also asked a staff member to educate the patients on the use of the Cisco phones for communication rather than hitting the call light. We all know the Cisco phones are the little phones that we carry with us, that way so they have a direct line of communication with us. This allowed everybody to be able to get in touch with the nurse on a more timely manner versus having to hunt them down. The second objective was the staff will be able to identify moments of delegation of tasks laterally to the nursing support and to nursing support appropriately. This one was a little bit harder to address with the staff members and honestly where my project stemmed from. There was such a lack of communication between the nurses and the support staff that it needed to be fixed. During my time with the unit at Norton as a whole made it mandatory for a staff member to read and acknowledge their job description. Management also agreed to talk to staff to educate them on what they can and cannot do. With Norton making it mandatory for the staff to look at their job description and acknowledge it, it allowed for people to know exactly what they can and cannot do and when there is what they can and cannot delegate to each other. The last learning objective was the leadership of the unit will increase the use of positive communication to staff members by utilizing the use of the in recognition, which is the in cards, and quarterly meetings with the manager. With the use of the shout out board, the manager agreed to send the comments on the card to the staff members electronically using the in recognition resource. This allowed the staff to know that their management was also seeing the positive comments that the other staff members were saying about them. It also was a very nice way for the manager to ensure the comment was received by the employee before clearing the board every so often. Instead of letting the comments just continually build up, it has to be reset every so often. So this ensured that the employee was able to receive it in an appropriate manner. The quarterly meeting with the manager I could not control, but the manager of the unit had staff meetings where he promised to step his game up and include more one-on-one meetings with each of the staff members. As I stated earlier, There was such a lack of communication on the unit that my aim was to improve this. Increasing the personal relationships among the staff was important, so using the shout-out board as a form of positive communication was important. As Cordata stated, when the personal relationships between coworkers are good, it does promote stronger communication. Coworkers that feel more comfortable with each other are more likely to treat each other with kindness and communicate in a non-intimidating way. The people will be more apt to ask for help from others and will create more trusting relationships between the coworkers. At my clinical site, I learned that new hires had to attend a class regarding communication styles. This allowed them to learn to separate personal issues from work and know how to address issues appropriately at work. This is also supported by what Corta said about having training in communication skills allows the professionals to separate personal life and work life. I did also notice that the new nurses and old nurses alike lacked communication skills when it came to talking to the nursing staff. The new nurses typically were scared to ask for help of the nurse aide and would be doing total patient care and end up getting behind on their regular nursing task. The most common style of delegation identified in the study conducted by Allen, Horton, Johnson, Evans, and Ball was the do-it-all nurse. This type of delegation was seen mainly in the newly qualified nurses and can also be seen in my current clinical site. The do-it-all nurse ends up being overworked with important patient care and tasks not being completed. With an increase in personal communication between the new staff members, it would allow the rest of the staff and new nurses to be more comfortable with delegating tasks to each other. My best practice statement for my clinical site is having a respectful personal relationship with coworkers improves the work environment, promoting productive communication and delegation. After my implementation of the shout-out board, there has been an increase in relationships between the staff members, directly affecting the communication between the coworkers regarding patients. Like my literature supported, having a positive work environment with personal relationships is very important in making communication on the unit efficient. When people have positive work relationships, it allows for the coworkers to be more comfortable with each other when communicating. The way I promoted positive relationships and communication between the coworkers was the use of the shout-out board, so people could leave positive comments for their coworkers, even if it was a small gesture for the day. I have noticed more respectful communication between the coworkers because they actually are being acknowledged by each other using the shout-out board. This in turn is increasing teamwork on the unit as a whole. Reflecting back on my clinical site, there was positive feedback from the shout-out board. It allowed the staff to positively acknowledge each other and for management to be involved and send more in-cards out to the staff members. This in return allowed for the staff members to increase their personal relationships with each other. I heard more talk among the unit as a whole for going out for dinner after work many a times. Other nurses and nurses' aides that previously did not delegate or ask for help were now doing so. With the increase in personal relationships, communication, it allowed the nurses to delegate more. The new nurses were getting their actual nursing duties done on time and they were delegating tasks finally. In one of the morning huddles, my preceptor read the patient satisfaction scores. They had improved over the past month, with communication being a large factor. The entire staff was congratulated on this. I believe the placement of the patient assignments at the computers allowed for faster response times. The number one factor, I believe, was the patients being more educated on the use of Cisco phones for a more direct line of communication. The staff members were also educated to keep their Cisco phones on them at all times, which allowed for other staff members to be able to get a hold of them in a more timely manner. The management became more visible to staff as well. The managers started showing up earlier to greet both shifts, and he was sending out end cards to different staff members from the shout-out boards, so he was able to see the positive comments as well. Overall, I really enjoyed my clinical site and learned a lot from it. It was very rewarding to see the unit grow as a whole in teamwork and communication because of one little small thing that I did for my class project.